We're a few minutes after the hour, so I want to welcome everybody to our sixth and penultimate presentation or training in this series. We are focused on how to determine whether your program or policy is ready for an evaluation. So this is useful for evaluators as well as policy folks and program folks. So we're glad to have you with us. During this session, we'll provide an overview of evaluability assessment, how you can assess whether your program or policy is evaluable, as it were, and programmatic factors that may limit the evaluability of a program or result in bias in an evaluation. Please remember that our final training in this series will be a month from now, August 15th from 3 to 4, and it will be on using evaluation and performance measures to inform each other. Before we get started, I have a couple of housekeeping items, and one is the webinar is being recorded. All of the recordings of these webinars will be available on the HHS Strategic Planning Resource Center, where we will post it as soon as we are able to. And the slides and any other materials will also be posted on the HHS Strategic Planning Resource Center. Please submit any questions that you have throughout this session or at the end using the Q&A tool. If you don't know how to use that, you can use the chat. But if you can use the Q&A tool, please do that. Feel free to put any questions in there, and we will answer them likely at the end unless they are very specific to something in the body of the presentation. I am very happy to introduce Rebecca Wells, our presenter today. Dr. Wells is a professor and director of the Health Systems Center at the University of Texas Health Science Center, Houston School of Public Health. Dr. Wells has conducted evaluations on a number of large-scale health and human service innovations, including federally qualified health centers, led integrated systems and care coordination programs. So that was center-led, not two different words. Sorry for that. And she is the author of a leading textbook on program evaluation, Health Program Planning and Evaluation, a practical systematic guide for community health. We are very glad to have her with us today to talk about knowing when your program or policy is ready for an evaluation. And there'll be tips on, if it's not, things you should be looking out for and things that you can do to make your program or policy ready for an evaluation. Again, put your questions in the Q&A feature, or you can use the chat if you want to. And we look forward to hearing from you. And I am very happy to turn it over to Dr. Wells.
Thank you so much. It's a joy to present on this topic. I believe it is a very important topic, and also one in that I think you're going to hear your own common sense validated in this session with maybe just a little bit new vocabulary to give you credence when you communicate with other decision makers. So the first thing I'm going to do is just to give us a little context on kind of who's in this virtual room, is to ask what roles you have played in policy or program evaluation. And it's all that apply. I'm interested. I can't literally see you, to get some sense of the roles that you are here to listen for. I'd love to hear about which roles you've been playing currently or recently in either policy or program evaluation. And I am going to suggest that we give it another couple seconds and then close out whenever my colleague deems us to have a pretty good smattering of responses. That's interesting. Yeah. And it's so this isn't surprising, right? That in the, if you will, kind of the life cycle, there are even more people who have been involved in the evaluations themselves. than in the decisions about how to structure or mercifully, for most of you, contracting out. Okay, thanks. Okay, that was already closed for us. Thank you. So now we're gonna get into the agenda for this hour, and I'm going to preface this by saying that my intent, or ours, because we've had a planning committee for this session, is to ensure two things for assessments of evaluability. One is realism, to support you and your contractors in clarifying what you can really do as you plan, so that evaluations are set up for their own success. And secondly, usefulness, to begin by clarifying the reasons for an evaluation, and then what information will, and you're going to hear this theme repeatedly, what information will really be available, what questions can be thereby addressed, who has an interest in the results and what they might do with those results. And so with those goals in mind, we're going to talk a little bit about policy or program evaluation readiness, the who wants to know, who the stakeholders are for any given policy or program, the purpose of evaluability assessments, and spoiler alert, they entail both the should we and begin to inform the how should we considerations of evaluation, and then what might limit an evaluation but doesn't necessarily fatally flaw it. So it's good to know that those things are okay, actually, versus what can actually lead to erroneous conclusions, which are bad. Finally, some steps to assess program evaluability and time for questions and answers. And I really welcome, I am curious what questions may emerge within the Q&A space. So please do jot down any questions you have as I proceed. And I'm also happy if we can manage the logistics to answer any of those as we go. So when considering whether a policy or program is ready for evaluation, in essence, earlier is better, right? But just how early is it constructively possible to decide whether to evaluate a policy or program? Essentially, it boils down to have the goals and the fundamental mechanisms been defined. And this is sometimes really clear when there's legislation, for instance, that outlines what social challenge a given legislation is intended to ameliorate or improve, and how it is required to occur, or it may be a program announcement within an agency. But fundamentally, once you can discern what do people mean, at least broadly speaking, by success, what will success look like, and what are they going to do to achieve that, the policy or program is ready for consideration relative to evaluability. And then when considering whether to evaluate, there's no need to make decisions that have already been made. So one question is, what's a given? Does the legislation mandate evaluation? In that case, then the real question is, or starts with, what evaluation has been mandated? And it may be in that situation necessary to clarify what's really answerable. So for instance, if a law is passed with the intention of reducing gun violence by restricting access in some way, or requiring some kind of safety education, the legislation is likely to be written with legislators' aides interpretation of how to evaluate, and therefore framed in yes/no ways. Does this new legislation reduce gun-related violence? Does a given human service policy reduce costs to Medicaid or costs recidivism costs? And you probably know this already. Here's where I'm going to start validating your common sense. You can almost never definitively answer those questions. But if that's what's been specified, okay, good to know. And you can typically gain some useful insights. So what is yours to decide? Maybe whether to evaluate, or it may be how to turn the mandated evaluation into the most constructive opportunity for learning about how to recalibrate policies or programs over time, and possibly whether to continue them. So our second poll is whether you are involved in the initial decisions about whether to evaluate programs. Again, this is, I'm going to go out here, I'm going to guess it'll be a minority of participants who decide whether programs are evaluated, but it'll be an interesting surprise if it's the other way. So just asking you whether generally, do you decide whether to evaluate policies or programs? And we'll be curious to see the results as soon as we have some pretty good number of responses to this. So yeah, so it's a minority, but a substantial minority of you who are involved in decisions about whether programs are evaluated. So that's good for me to know, and it's actually pretty close to even split given the size of the group. Thank you. And we can close that. Yeah, I can. Oh, look at that. Okay. Now, then once you or someone else has at least provisionally decided that a policy or program should be evaluated, then I think the next question to ask is who wants to know whether that policy or program has worked? And it's often includes lawmakers and advocates and agency administrators and the program staff, the people in the agencies who are implementing the program or policy, undoubtedly have a lot of competing obligations. So one question to consider, to try to get a sense of at the outset, is, do they want the answer to this, or are they overwhelmed or leery of evaluation? It's just good to have a sense of where evaluation fits in the priorities of the people whose cooperation you would need to conduct those evaluations. And that's intertwined with issues of what kind of data you could use for that evaluation. It's also good to have clarity about that from the outset. Also, what are each group's goals for that policy or program, and what do they want? What do they want from the program, and what do they want from the evaluation? Sometimes some stakeholders they genuinely want to know, should we change this policy or program, or should we end or grow it? Other times, one or more stakeholders want to justify a policy or program, and it's good to have a candid internal appraisal of that, because that will affect how they engage with the work you're doing. So related to that, who will use the results, and how? Will they be using the results to justify continuation, to justify termination, for developmental purposes, or some mix, and it is probably different for the different stakeholder groups. It's also, of course, important to consider from the outset who has not been historically at the table and has not been had power to inform the shape of the policy or program. In my experience with evaluations of programs in health and human services, my experience has been that they have been formulated and funded largely with the intent of reducing costs to taxpayers. So success is defined in terms, in large part, in terms of reducing, say, emergency room visits or other forms of hospital utilization or incarceration, other very expensive uses of public systems. And one of the first things I learned when I began to investigate care coordination in Medicaid funded contexts was almost wholly unrelated to what the mothers in those programs wanted. They were just ships passing in the night, if you will, and across these and other kind of care coordination, integration related contexts I've examined, the people who are being served often want services that are accessible, respectful. Mothers have talked about their caseworkers as friends, and that means they're looking for very different things. Success means something very different often for the people served than it does for the people who have enacted the legislation or developed the programs. So how soon should you ask the people a program or policy seeks to serve? I would say as soon as you have a clear sense of what that policy or program is and how you're going to use their time, because of course, people with in many health and human service programs are focused particularly on people with low incomes, and having low incomes is also a source of time constraint. So people are all busy. People with lower incomes are busier, arguably, than others. And so the request should be clear about how you want to use their time, ample in support for that time, and there should be then consistency of conversation to truly listen to what the people served want from the policy or program. The purpose then of evaluability assessments is, and I'm going to pause and define evaluability assessments, since that's our topic, our headliner for the day, as systematic processes to determine whether, when a policy or program is in a condition to be evaluated, and whether that evaluation is justified, feasible, and likely to lead to useful information. So the purpose of pausing and deciding whether or not to evaluate a given policy or program includes identifying what measures stakeholders with typically legitimately very different perspectives would believe, consider valid, how you might use and make the most use of available information, and how to develop shared realistic understanding of what's possible. So in another project, I was examining the new provision of primary care by community mental health centers, and launched an evaluation with 10 community health centers across the state of Texas, and conducted this evaluation in collaboration with those centers and with the state mental health center membership association. And so to identify ways to measure the impact on cost, quality, and health outcomes, my coworkers and I essentially poured through the documentation for the health records, the data that they were already collecting in these health centers, and had a series of conversations, conference calls with the health center, the mental health center, at frontline staff and administrators, talking through what different measures meant to them, and then had a meeting in an afternoon. And we all met in person. This is pre-pandemic. And what I discovered, my coworker and I discovered when we got there midday, was that the executive directors, as largely executive directors of the health centers, had all met that morning and decided which measures they were going to allow us to use. And so we talked about what was required by the state and federal funders, and that included that we needed to somehow legitimately address cost, quality, and health outcomes, and which of those were acceptable to them. So on our list, for instance, we had body mass index, which they were measuring as they began providing primary care. And the health center representative said, no, we don't consider that valid. I think their concern legitimately was that it's very hard to shift to show a demonstrable impact on weight. And so we said, okay, we have other health related measures, including blood pressure. So it was through this kind of dialogue and these and other projects that I, as the evaluator, I answered the question, can we evaluate this? And that led naturally into how can we evaluate it? So the third poll is are you involved in deciding how to evaluate programs? And I think this is going to be a majority yes. So we'll ask you for like lightning quick answers, and then I'm going to project like 70 to 80% of affirmative answers. Let's see what we get. Wait for it. I'm curious what the proportions were. Involvement in deciding how to evaluate programs. Not whether, but how now. And to my colleague behind the curtain, I'm going to say, yeah, please go ahead and show results as soon as you're ready. And okay. Involvement in deciding how to evaluate programs. And these are mutually exclusive choices. For this poll, okay, so actually, again, it's not as lopsided as I anticipated. But the majority are involved in the how as well as the whether. Thank you. And now I want to talk about two sets of limitations. And this slide is the less bad limitations. These are factors that I actually think sometimes can be exaggerated, that limit the scope of an evaluation, but do not necessarily invalidate findings or make it impossible to conduct a valid evaluation. One you will always hear about when complex innovations are being implemented, which is pretty much everything in health and human services, is heterogeneous implementation. So, for instance, in the Texas Medicaid context, the first 10 programs we evaluated were care coordination related to people who had been using emergency departments frequently. And we sampled for diversity across rural, urban, and suburban sites. What we found was that one of the selected rural programs was simply unable to start the program at all. And this led to the question of whether we should keep them in the sample. And our conclusion was yes, because it was informative that a hospital that had applied for funding for a care coordination program and received the funding was still unable to use the funding. And in fact, the CEO was kind enough to talk to us about what had happened, and essentially the how challenging it was in a small organization to implement a very complex new program. So I view heterogeneous implementation in health and human services as almost inevitable and worth measuring. It's worth measuring the extent of the nature of implementation, so you have some sense of what was involved, but it is not a reason not to evaluate. The second can be program instability, and this is really related to heterogeneous implementation. And so in the context of these mental health centers providing primary care, what we found among the 10 mental health centers providing primary care was that across the year we followed them, 4 out of the 10 either had a delay or a significant pause in operations because of a gap in primary care provider availability. And so I view program instability the same way I view other forms of heterogeneous implementation. They are informative, and it necessitates collecting enough information to know what's going on, so that we weren't, say, testing the effects of integrated care on these cost, quality, health outcomes without knowing that at any given time, 2 or 3 of those programs weren't even operational. It was necessary to know that. At the same time, that was part of what I felt we were usefully learning. And I mentioned before that the program staff may have varying motivation and just time and skills available for participation in evaluation. And so it is helpful to know how high of a priority evaluation is for program staff, and to, within ethical limits, treat them as your friends and make it as easy and enjoyable and useful for them to participate as possible. It's also necessary to scope an evaluation to the available budget. Typically, evaluation budgets are much too small to conduct anything like to answer anything like the questions that are being asked. So I was speaking with a colleague recently, and a federal entity has contracted with him for under $100,000 to answer the question of whether I will just say a collaborative strategy is working worldwide. Okay, well, he is not going to answer that question for under $100,000. So It doesn't invalidate the evaluation, but it does necessitate recalibration, rescoping of the evaluation and clarity about what questions can be answered with validity for a given evaluation budget. Limited data, there are typically, there's a lack of existing data on outcomes as well as systems to collect those data, and a lack of program documentation, as well as evaluator skills. And this is, most people are proficient in some range of evaluation, and when the questions are necessitate different methods, that can limit what can be accomplished. And so it's helpful to be probing to clarify the skills that people available for evaluation have, so that the evaluation is scoped to those resources as well as the total budget and program staff, interest, etc. And as well as the time to trace the implementation effects. Any given intervention may have different effects over time, different effects initially than later. So just being again realistic, and also tracking when did any given intervention start, which turns out to be harder to do. It's like counting kids on a field trip. You think, surely I can keep track of like 17 little people, and then it actually turns out to be really hard to keep track of those 17 little people. Well, establishing the start date for a health or human service program is often actually harder than I would have thought, but it's worth doing, and then landing on something and documenting and holding on to it. So all of these are factors that can limit evaluability of health and human service policy and program interventions. Now we're going to get to the bad stuff, factors that can bias an evaluation. And what I really mean by bad is that can lead to erroneous conclusions that mislead decision makers, such that they decide, worst of all, to expand something that's not working, or end something that is working, or simply to make changes that are not based in reality. So factors that can bias an evaluation include concurrent changes that can confound inferences about what that policy or program achieved. So the pandemic is a pretty salient example. Employment rates, policies that have greatly affected the number of people, for instance, who are eligible for Medicaid and SNAP. When there are large concurrent changes, those are going to make it very difficult to conclude that a given policy or program has affected a given cost, quality, or health or functioning outcome. So, and there are often not truly comparable comparison groups, or in a truly comparable comparison group that's not getting the policy or program that one group is. And if there is one, let's say that there is a very comparable region or county or school or health system, then there may or may not be enough data on that comparison group to be tracking the changes over time, so that one can make a confident inference about what the policy or program accomplished versus these other concurrent factors. A really common design for evaluations of health and human service programs is pre, post, without comparison, and that is these were the rates of again dropping out or educational test scores or out-of-home removals or whatever the indicators are before the system implemented a new policy or program. And then these were the rates after. And that just managers make decisions on those bases all the time because they're the best available data. They also, that pre-post without comparison design tends to overstate the effect of the policy or program. So that can be useful when people want to justify the policy or program. But in the quest of what's really going on, it is really problematic to use that design. And it's so, if that's what's available, it's at least good to go into this with eyes wide open that one is likely to get an inflated estimate of the effect of that policy or program. And of course, relying on people, say, who are getting funded to implement a policy or program and then surveying or worse yet, interviewing in an identified way them about how well it's going is destined to lead to what researchers sometimes call socially desirable response bias. I mean, savvy administrators, my experience, the higher up, the savvier they are about positively portraying whatever the policy or program is in ways that may or may not be true indicators of the level of implementation or outcomes thereof. Other sources of biases include that when the evaluators, any of the people involved in evaluation simply have a different set of perspectives on the communities and their strengths and needs than the members of those communities have. We all have our assumptions about what exists, what's real, how things ought to be. And it's the real threat, I believe, is when well-intended evaluators proceed without explicating what do they assume about the way the world works, and what do providers assume, or whether those are clinical or non-clinical staff, and what do the people served believe, so that if there are differing belief systems, they're acknowledged and respected. Another common source of fundamentally biased evaluation results is data from people who don't fully represent the people the program seeks to serve. One well-documented example is WIC, the Women, Infants, and Children program that has now evidence indicating its effectiveness that is largely developed from participants in those programs. The problem being that people who don't participate in programs tend to systematically differ from people who do participate in ways that are not measured. So it's not to say not to evaluate, but instead to be cognizant of what that evaluation can yield, which may be what could this program or policy achieve for the people who choose to participate. Similarly, the people who stay in a program long enough to provide those repeated measures that we all want so we can measure change tend to differ systematically from the people who do not stay in those policies or programs. And there are some statistical ways to address that. It's important to recognize the potential for bias of that non-random attrition bias. And finally, health and human services. One way that evaluations may be biased to underestimate the potential impact of health and human service interventions, I concluded, it took me a while to figure this out, is that these programs are often offered in the field at such low dosage that the lack of results is ambiguous. And this occurred to me after a couple of care coordination related project evaluations in which I realized that for adults or children with complex needs who had been flagged as needing multidisciplinary teams, the average number of encounters was often 1 or 2, with often no home visits. And so it's, again, that may be the reality. It often is the reality of Health and Human Service programs and policies. And I think it's also important to document what that dosage is and to be clear so that the results are not used to prove that quote unquote nothing works, because those, if there are no results, what they may prove is that a very low dosage intervention did not achieve its intended results. Okay. Now that we're getting into all the things that worry us, what are your biggest concerns about the evaluations in which you are involved? Pick as many as apply. Just to say out loud, in terms of time management, I am going to plan to stop at 10 minutes to the hour. And Susan Jenkins, if you would like me to stop earlier or later, please let me know. But I'm thinking, yes. What do you think?
Yeah, that's fine.
Yeah. Okay. All right. I'll talk a little bit more and then wrap it up so we can hear what people are thinking and address questions. Oh, isn't that interesting? So the most common concern is a lack of clarity about evaluation goals. Very interesting. And I've tended to worry about being ignored, but results being misused is a bigger problem. So thank you. This is really interesting. Really interesting. Lack of clarity, misused results, the most commonly chosen. Okay, let me talk just a little bit more before pausing for Q&A and noting that, again, I see this evaluability assessment, should we evaluate, as progressing very naturally into the how should the evaluation occur decisions, which may at times lead to the, you know what, we're not actually ready yet to evaluate determination. So steps to assessing whether a policy or program is evaluable starts ideally after, as I noted before, it's been defined, what are the goals and what are the basic mechanisms, but before implementation, although often we get the opportunity to evaluate policies and programs midstream, and we can learn things in those contexts. And asking, what is the scope of this policy or program? What are its goals? What does success mean to different stakeholders? And sometimes people talk about the causal chain or logic model. How is the program expected to be implemented and thereby improve proximal and longer term outcomes? And as well as and I really already addressed how exactly, and what is the timeline for those expected effects, and as I was describing before, in relation to potential biases, what else could really be the causal factor for affecting those outcomes, and is there a way to reduce that confounding so there's more confidence that the conclusions drawn about the effects of the policy or program are valid. So one more poll. When do you tend to become involved? Are you involved even as programs are being designed before implementation, which might be like the perfect world, right? Which is someone says, I want to reduce gun violence. I want to decrease emergent use of hospitals. I want more third graders to be showing reading proficiency. I want fewer people to be incarcerated. And wouldn't it be great if they said, oh, what we need is evaluation assistance. We need people to help us think through what are we trying to achieve and how. Let's see how close we are to that. Yeah, all right. Sorry about that. Reality, majority after the implementation has begun. Although, I mean, a happy 25%, before implementation, and that's about as good as it's typically going to get. And like I said, if you are involved in evaluation after implementation has begun, all is not lost. It's just helpful to be realistic about because often there are baseline data that can be used, and then to design accordingly. Okay. I want to just spend these last few minutes of me talking before we see what questions we've surfaced, talking a little bit about how to identify valid indicators of implementation and effects, starting with the evaluation budget in mind, and previous empirical findings. So not like reinventing what's already known. So for instance, we already know that contraception, if used as prescribed, if you will, or recommended, generally prevents pregnancy. We don't need to reprove that. This could enable the evaluations moving forward to focus on how to improve access and how to improve information so that people are using methods as recommended. What comparison groups are feasible? Understanding that randomized assignment is ideal for causal inference because it reduces the possibility of confounding, and it may be there can be ethical problems, right, with saying we're going to randomize all of you want this service, we're going to randomize you to get it and you not to get it. But it can be possible with sequential enrollment. A project I'm involved in now has an integrated care model that's being implemented 3 clinics at a time in 6-month increments, so that the clinics that will be participating in 6 months can become the initial comparisons for the intervention clinics. This kind of thing can achieve the level of rigor of randomized design without the ethical or practical complications of withholding services from people. Are comparison groups feasible? I talked a little bit before about what might constitute a comparable comparison group. What secondary data are available? National surveys, regional surveys, administrative data, understanding that there is often a significant gap between what administrators believe their data can do and what their data can do. And they are saying this with all good intent. And so there is a lot to be said for getting someone's hands on a little bit of data and having a look at it before designing an entire evaluation around that. And so, Susan, I see you smiling at me now. I feel like this is my cue to skip down to final thoughts and ask for questions and answers. And I can see you, so if you're frowning a little bit, I'll even respond to that. Okay. As I noted at the beginning, the best evaluation planning is realistic. I'm going to say circumspect, as scoped relative to available resources, or if you have the power, adequately resourced, and the subject of continual conversation among all stakeholders. So now I'm going to move to a question that the program sponsors are interested in, and asking you if you would please jot down in the chat bar your just immediate reactions about what kind of tool would help you to determine whether your program is ready for evaluation, whether it's a sort of a checklist of factors to consider, or links to a little bit more background information, or just if you, because we've seen through the polls, many of you are already in the thick of this and have been making decisions with the best available information, what might make it a little bit easier to make those decisions. So please jot down any of your sort of tool, checklist, wish list in the chat, and you can continue to do that as we proceed. And now I think we're ready to go to questions. Susan, I see you're off mute. You have you're going to take over from here and moderate the questions?
I am. So
Okay.
Thank you so much for presenting to us. We really appreciate your expertise and your examples, a lot of excellent information that you provided us today. We do have a few more minutes because we will close a couple of minutes early so that a poll can pop up and you can have time before you go on to your next meetings to fill out the poll. We hope, giving us feedback on the training. But a question is, thinking about evaluating a program or policy, what are some of the documents, the types of documents that we should look for a program to have to help us to determine if that program or policy is evaluable?
Most of the available information for evaluation starts with people collecting information to get paid. So it may be case management files, it may be, it's generally in one way, shape, or form billing related, whether for individuals or periodic reports, like, the FQHC uniform data system. And I would start there. And I tend to want to get my hands on the actual instrument and see exactly what are the items and how much could I milk out of those, even if nobody else wanted to play with me. Before getting into primary data collection.
Excellent. We have a question that just came in. How can we figure out whether data that should be available for evaluation really will be available? So I don't think you've already touched on the quality of the data, but I think this is, will we actually be able to get it? People say it's there, but how do we really determine?
I think you have to actually draw a sample. And I'm thinking about these community mental health centers whose executive directors very genuinely offered to share their data. All 10 center directors did, and 4 of the 10 centers were unable to. And we really didn't find that out until their IT staff tried to pull those data. So if there is some way to provide a little pilot funding and just literally pull down the data and see how messy are the data? What would it take to get them to the point where you can get some sense of descriptively and possibly correlationally what's going on?
Excellent. Thank you. So we are at the end of our time. We do have a question that came in that is about a tool that would be helpful. So we will, for the audience person that put that in, we will take a note of that and work with that. I think we may have one other question. Yes. Does it make sense to include data requirements before awards to grantees?
I think so. And those of you who have been involved in, say, NIH grant proposals, those proposals tend to have tables with descriptive statistics showing like we have these data in hand. And so to verify that the data people honestly plan to evaluate or assess will be available to them. I think even asking for some descriptive statistics not like a ton of work, but just enough to know that they can really pull those data, can avoid some unhappy surprises down the line.
Okay, well, thank you so much again for sharing your expertise and your time with us. We really appreciate it. And as folks know, I said in the beginning, August 15th, we will have our last training in this series about using evaluation and performance measurement to inform each other. So we hope that we will see you then. And so we're going to close out. When we close out, a poll will pop up so that you can give us feedback on this session. So thank you, everyone. Have a good rest of the day. And thank you so much, Dr. Walls. We really appreciate your time.
My pleasure. Thank you.